So do they need fluids or not? I can't tell you how many patients get admitted to the hospital and they don't need any fluids at all. Their volume status is perfect. They're not hypovolemic. They're not dehydrated. Their electrolytes are perfect. And for some reason, somebody decides to admit them and put them on normal saline. We're going to talk about the difference of fluids in the hospital and the rate and what you need to do there. But not every patient that needs to come into the hospital needs fluids. Example, chest pain. Comes in, needs a stress test in the morning, and then they're going to get discharged. The patient does not need to be on fluids throughout the day. Patients who come in with other issues, they don't need fluids at all. Their electrolytes is perfect, their volume status is perfect. You don't need to put every patient that comes into the hospital on fluids. Do I need to repeat the labs every morning? I can't tell you also how many patients get admitted and they get an order for labs daily. Even though their labs are okay, their creatinine is okay, electrolytes are good, everything looks okay, but at the same time, for some reason, they order labs every day. Now, keep in mind something here. When you order labs on a patient, what you're doing is that you're ordering somebody from the lab or phlebotomist to come into the patient's room, stick them, which is painful, get labs, take that and study it. So if you don't need to get labs every day, don't hurt the patient and don't do these labs just for nothing. Of course, do labs if you're following something. So if the patient came in with acute kidney injury and you're following their creatinine, if they came in with hyponatremia, hypokalemia, electrolyte abnormalities, and you started them on fluids and you're trying to correct it, of course you're going to follow labs there. The patient came in with an infection and you want to follow their white count. And it goes on and on. So if you're not following anything, don't just repeat labs because the patient is in the hospital. Now, if the patient has been in the hospital for a few days and you got labs when they came in, you can make an argument to check labs maybe in 3-4 days, make sure their labs are okay. But otherwise, you don't need to check their labs on a daily basis.